My name is Charissa Knihtila. I met Hasini when she was like 5. She was in dance competition with my daughter, and it's been a little weird for me to see her as like a sort of grown up because I haven't seen her for a while. So I'm excited to kind of reconnect a little bit. What I do as a job, so I have my PhD in psychology with an emphasis in behavior analysis, and I teach at a university where we talk about using behavior analysis to help change um, just any kind of sort of behaviors that you may want to change in your life. A lot of the students that I teach end up working in the field where they are working with students that have developmental disabilities and working on teaching them how to do new skills or decreasing, problem behaviors that might be there in the younger children or in the older kids. So it's just a lot of analyzing the behaviors that people engage in, the environmental factors that kind of come into play, and then helping people feel better in general. So that's kind of what I do. Um, okay, we're just going to keep going. So outside of that, I am starting a consulting company. My focus, actually, interestingly, is going to be on high school students, is really what I would like to focus on. I have, like I said, a daughter who's a junior. Hasini and I were just talking about how junior year is a lot. So I've been kind of watching my daughter and her friends go through all of this, and she has me here kind of helping her manage the stress and figure out how to get through it. But she has a lot of friends who don't have that. So she will take things I say to school and be like, my mom says you should do this. She's like, Mom, I'm like a mini therapist, which you should not be because she is not qualified to be anybody's therapist. But I like that she's trying to help people manage and calm their stress a little bit. So I'm looking to kind of get into that of helping kids de-stress, specifically high school, specifically performers. Okay, so the first thing I decided to do is just share a few stats with you. Um, 70% of teenagers, so that's between 13 and 17, label anxiety or depression as something that's a major issue among their peers. So that's something that we obviously don't want for that to be a big thing, but it is very often labeled as something that's a problem. We also have 75% of high school students reporting that being at school makes them feel bored, mad, scared, or stressed out a lot, right? So again, that's a really high percentage of students that are just feeling stressed out at work. One of the stats that I found very interesting is that on a scale of 10, adults would rate their stress as an average of about 3.8, where teenagers are rating their average stress as a 5.8, which means all of you are saying that you are feeling more stressed than the adults in your life, which is definitely something that needs to be kind of targeted and talked about. Adults do have a lot of stress, but we as the adults should be here to help the students who are feeling so stressed out not be so stressed out, because you are children and you should be able to live your life in a non-stressed manner until you get to that point where, sometimes stress comes into play, but we don't want all of that there. It's just really not good for you to hold all of that stress. We also have that 75% of students in high school say they have stress related to schoolwork, which is very common, obviously. How many of you are taking AP classes, one or two or three or more? Yeah, most. Okay. That's very common, I think, too. Do you think that the AP classes increase or decrease the stress level?
I think they might increase sometimes, depending on what class you take.
Okay. I would agree with that. So something that you like, maybe it didn't necessarily increase it, but the other ones, yes. I had a conversation with my daughter when she started looking at all these AP classes, and she said, well, I think I have to take AP Bio. And I said, no, you don't. You hate science. Why would you take an AP science class? You hate that. find an AP class in a subject that you like so that you don't hate every minute of it. And she was a sophomore at the time, and she was like, I don't have to take AP classes. I was like, no, you do not have to take AP classes in classes you don't like. Find the ones that you like and put all of your time there. So it's that idea of finding those things that you like to do and then expanding on that, right? Rather than being stressed out doing something that you don't like. A couple other stats. I have 30% of teenagers report feeling sad or depressed due to academic pressure, and that students who have those high stress situations are more likely to try to get rid of those feelings by using drugs or alcohol. So that's something that we need to be aware of as well. And they also have increased health issues, like physical health issues as well. Okay, so let's move on. So in today, what Hasini asked me to talk about was a little bit about depression and a little bit about stress. So I want to first really clarify that depression itself is an actual mood disorder that causes persistent feelings of sadness or a loss of interest. So when you are looking at somebody being depressed, that is a clinical diagnosis, right? If you're actually getting that diagnosis, you have to go to your primary care physician, there's mental health counselors or a psychiatrist to really diagnose that you have clinical depression. So that is something that is in the DSM about like kind of what that really is. That's your clinical diagnosis. Some of the causes of clinical diagnosis or clinical depression are those things. There's really no specific cause of what, or no known cause of what actually makes depression happen, but there are a bunch of factors that the researchers have been able to figure out come into play. They just can't quite pinpoint exactly what it is that causes depression. They can say this might trigger it, but in one person that might trigger depression and in another person it won't. So some of those things are biological. So when you look at a person who has been diagnosed with depression, their brain actually looks different in a scan than someone who doesn't have a depression diagnosis. The brain chemistry is different. So this is where there's these interactions. And I'll tell you, science is not my jam either. So I don't exactly know how all of this works, but within your brain chemistry, you have these neurotransmitters and neurocircuits. They all work together. When they're working together right, they regulate your mood, meaning you are not always sad, you're not always happy, your mood follows kind of what's happening in your environment, and it's regulated by those interactions between those two pieces. In someone who has clinical depression, those interactions aren't working correctly. So they're not talking to each other the way they should be. There's also hormone changes that can cause depression. So I'm sure you've heard of things like postpartum depression. When you have a baby, sometimes, like when you have a baby, your hormones go crazy, right? And so sometimes that can cause postpartum depression in women because their hormones aren't regulated. That's also why teenagers can sometimes end up with that kind of the clinical diagnosis of depression because your hormones go crazy in your teenage years too. So it's why you want to be aware of kind of what those symptoms are to know if you should be talking to somebody about it. There is also the potential that it's inherited. Mainly, this just means that it's a little bit genetic, but they don't really know what gene it is. So if you have a blood relative that has a clinical diagnosis of depression, you are more likely to also experience depression, but it does not necessarily mean you will for sure. So the research is still trying to figure all of that out, but it's more common, but not guaranteed. Some of the symptoms of clinical depression are these feelings of sadness or hopelessness that last a long time. So feeling sad for one day wouldn't be considered depression. It would have to be a persistent feeling of that sadness or hopelessness. Sometimes people have angry outbursts over something really small. They have a hard time sleeping. There's a really low energy. So even small tasks seems like too much for them to get done. They're very anxious or restless. a lot, a lot of people who have clinical depression will report feeling guilty or feeling worthless, like nothing I do is good enough, those kinds of things. And then the far extreme side of this is people who have those thoughts or attempts of suicide. So that is kind of the very far extreme symptom of depression. Okay, any questions? Okay. All right, so now here's where I get to say, you can feel depressed and not be depressed. So I think it's really important to understand that emotions are normal and okay, and that there is a range of feelings that come within your daily life, your weekly life, whatever it might be. All of your emotions that you're feeling are temporary and they're going to change. So having a situation that makes you very sad, even if you're sad for a couple days, does not necessarily mean that you are never going to get out of that. You can be looking for, let's say you have a friend who went through a breakup and they are really sad and they don't seem to be coming out of it. You can look for some of those other symptoms of depression, see if they're there, see if it's something that you're concerned about, talk to them about it. But very often, that's just an extended period of sadness that then will sooner or later break out of it. You don't always want to assume that, but you have to remember that as humans, we feel this full range of all of these things that are going on, and that's normal. If you were happy all the time, you wouldn't know you were happy because there would be no differentiation between the days when there's something that makes you a little bit sad or something that makes you mad. So it's all okay. And no emotions are wrong to feel. You just have to learn how to experience the emotions, accept that they're happening, and kind of live with them and work through them in a healthy manner. Okay. So that's my little soapbox about how like it's okay. I know that sometimes we hear those things where it's like, oh, they're feeling sad, and people will say, I'm not supposed to feel sad. Sometimes you are supposed to feel sad, and that is okay. I see your hand up. Can you tell me how you say your name?
Oh, it's Yashmin. And I was just gonna ask, like, what's the difference between being depressed and like feeling depressed, you know?
Okay, yes. So the main thing between those two, right? So you have this idea of feeling depressed is it's that temporary emotion. So if you are technically clinically depressed, it's unlikely that you are going to have even like a moment of happiness. So someone who has a clinical diagnosis of depression, maybe you love, okay, I'll use myself as an example. I love watching dog videos on Instagram because I am a millennial mom. I love dog videos, right? My child makes fun of me a lot, and it's fine. But if I'm having a bad day and I'm watching these dog videos, one of them is going to make me giggle at some point. That means it's more likely that I am having a depression moment because there's still something that can make me happy. Even if that happiness is just for a minute, it's still there, right? Or my husband will crack a joke, even though I'm in a bad mood. He'll say something, and I'll be like, oh, he's so silly, like, and I'll smile. So that is more of I'm feeling depressed. I'm having a bad day. I'm having a bad week. This is a depressive kind of feeling that I'm in. Somebody who's clinically depressed, those moments typically don't happen. They're not going to be giggling at a dog video, or somebody will say something funny and they don't think it's funny because there's something going on in their brain chemistry that doesn't allow them to find those other emotions when they're in that depressive state. Does that make sense?
Does make sense. I do understand that.
Okay, perfect. Okay, so, oh no. Oh, they're not out of order. We're going to talk about how to deal with them later, but I was going to flip it up here. Okay, so I'm going to switch over a little bit to stress, mainly because like I said, that idea of depression is when you think about being clinically depressed, it's very different. And a lot of times what's happening with people, and not always, but a lot of times what's happening is you are feeling very stressed and you are sad because of it. Okay, so those two things can also go together. So if you're thinking about stress, this is any person's, their body's non-specific response to any kind of demand, pleasant or unpleasant. Everybody's definition of stress is a little bit different. A lot of the definitions include things like, oh, there's like physical stress. This workout I was doing is too hard and I can't do it and I'm stressed about it. Or I have to run a mile at school and I have to do it in this much time and I'm so stressed I'm not going to be able to do it. It's stress on your body physically. There's mental stress. There's also emotional stress. All of those things kind of go into play, and how you define stress can change based on what is going on in your life at that time. But it is a body response. When you're stressed out, you can kind of feel it inside your body. So it's all there. There's 4 main types of stress, and this is where I was going to share a picture if I have Hasini's approval to do so. We have good stress in life, right? Every time people think about stress, they're like, oh, I'm so stressed. It's this awful thing. Sometimes there's good things. There's stress that actually is good for you. This idea of making new friends, when you go into a new place and you don't know anybody, you feel a little stressed, right? You're a little nervous. Your body might be a little tense. You're feeling stressed out, but it is there to kind of push you forward and help you work out and kind of make those new friends. If anybody is in a relationship, sometimes there's stress in a relationship that's not necessarily bad. It's that idea of like, oh, we're going to prom. Is he going to give me a kiss? Is he not going to give me a kiss? I'm so stressed out about this. But it's not bad stress. It's just anticipation stress more than anything else. The other thing that pops up is things like, this is where I was talking about performance stress. Okay, so this is, my daughter is a performer. She does a ton of shows. And when you are a performer or a dancer, like there's that stress in your body before you step on stage, even though you do it all the time, there's always like a little bit, right? Where you're like, oh, am I going to hit that thing today? But when you have supportive people coming to help you, the stress is there and then it goes away. And then at the end, you have little hugs from friends. So cute. Another stressor that I think is probably coming up for all of you that technically is good stress, even though it doesn't feel like it, is this idea of graduating, right? You're all really close to graduation and you're getting ready with those college applications. And what are you going to do? And are you going to go to college? Are you not going to go to college? Where you go to a 4-year program or a 2-year program? All of those questions. And it puts a lot of stress on you, but it's not necessarily anything bad. That's exciting stress. So that's your first kind of stress that you can see in life. Distress is the bad type of stress. So this is where you have things like bullying at school, or if you're having academic problems at school, that's going to cause bad stress in your life. That same boyfriend at prom that you were trying to decide if he was going to give you a kiss or not decides to break up with you 2 days later, and then you're sad and stressed, and what is he going to say about me to his friends, or what are my friends going to say, what are people going to think, right? So that's that idea of the bad stress in life that can often put you in a depressive mood, right? That's where you see the overlap between stress and depression. Does that make sense? Okay. The other 2 types of stress are a little bit less common, hopefully, for most of you. The idea of acute stress is that fight or flight. So this would be like if you were, I don't know if any of you drive. No? So we'll say you're driving with a parent then. If you get into like a fender bender, right? If you get rear-ended, there's a fight or flight kind of reaction that happens in your body where you're like, oh, what do we do now? And that is that acute stress. Or if you are walking down the street and somebody starts running at you, you're like, what do I do? Do I punch this person or do I run the other direction? That's that idea of acute stress. So my hope is that Most of you are not really experiencing that, but that's what that's called if you get to it. The other one is what we call chronic stress. So this is something that when you look at it, it talks a lot about like bills and kids and all these things, stuff that y'all probably don't deal with, but it doesn't mean you don't have daily living stressors. This is where things like grades and schoolwork and practices and all of that stuff would come into play for you that can cause those daily stressor points. But we would hope that that is not sticking with you forever, right? So those are they're less seen in kind of the teenage world, and the distress is really the main area where we're seeing a lot of those stress put on teenagers. Okay, so the next question is, how do you manage these things? When you're talking about depression, I'm going to give a really quick thing here, because if you were to get diagnosed with clinical depression or have depression, you have to talk to your doctor or your mental health counselor. Usually medication is necessary to help with the transmitters in your brain and figure out your brain chemistry, even it out. You can also use the stress management techniques that we're going to talk about next. But if you have someone in your life that you think, is having those hopeless feelings, they're doing, they're having suicidal ideations, anything like that, those are all things that have to be managed with the help of a physician or a mental health counselor. You want to make sure that you have somebody who is qualified in helping with that. Usually it's somebody who can prescribe medication. So I don't have a degree that can prescribe medication. So if somebody were to come to me and say, I'm feeling this, I'm feeling this, I'm feeling this, and they tick all the boxes where I think they might have clinical depression, I would need to refer them to somebody who can do that sort of diagnosis. The degree that I have does not allow me to diagnose somebody with those things, and I would need to send them to somebody who could. And then from there, I can say, if they say that you don't have it, you come back to me, we'll work on your stress. But I really do think that you should go get evaluated by this professional who would have that kind of competency. But stress is something that I can give you some ways to manage. There's a lot of things on here, and I want you to know that these are not the only things that you can do to help with any stress that you're feeling. I'm going to pull out a few of the things that I think are most helpful for high school students to help manage their stress. First, you need to make sure that you're getting enough sleep. Sleep is underrated in general in life. And I know you're all busy and you've got this thing that you do and that thing that you do and the AP classes and the non-AP classes and all of those things. And when I hear students say, like, I was up until 2:30 studying math, and then I got up at 5:30 to go do my workout for soccer, and then I was at school by this time, that's not enough sleep. It's going to increase your stress rather than decrease it, because your body needs that time to reset in order to make you successful the next day. So if you are someone who's up super late and then up super early, you really need to try to figure out how you can get yourself to a point where you're getting like a solid 6 to 8 hours of sleep. 6 is too low, but if you're getting less than that right now, that's where you should shoot for. And really that 8 hours of sleep is really what you need. So everybody sleep more. That comment is for myself as well, but everybody should sleep more. The other thing that I think is really helpful is what it is that you're eating. So, or drinking, right? Because I think a lot of people are like, I got to stay up late. I'm going to have this caffeine. It'll help me study. It'll keep my brain active. And while that is true, caffeine will keep you awake. It is going to help you stay be able to attend to what it is you're doing, but it also crashes you. It's that same thing with sugar. When you eat too much sugar, you have a ton of energy, but as soon as that sugar wears off, all that energy is gone. So what you want to try to do is make sure that you're eating some protein, you're putting some sugar in there, but try to make it, like sugar from fruit, not necessarily sugar from candy, all of those kinds of things. But You can also have like a piece of cake. It's fine. Just make sure you're not only eating cake, right? Find some balance and drink a lot of water. The other things on here that I was going to try to talk about are if you are willing to try and do any sort of breathing techniques or meditation when you're very stressed out, it can be super helpful. I was not a believer of meditation. I was like, whatever, breathing techniques. Psh. And then I started going to yoga, and I went to yoga initially because I was like, yoga is such a good workout. And after about I would say 2 to 3 weeks of yoga, I stopped going because it was a good workout and kept going because it was 1 hour a day that I got to turn my brain off and think about nothing except for my breath and the way that I was breathing and the way that I was moving. I do not think that all of you need to spend an hour a day doing any sort of meditation or breathing techniques. But if you find yourself in a situation where you are feeling stressed in your body, finding some of those breathing strategies can really help with the body reaction to stress. When your shoulders go up and your arms get tense, if you're able to take in those, however they tell you when you're a kid, I think it's like breathe in for 5, then blow out the candles, those little things that they talk to you about. It will lower your shoulders, decrease the physical pieces of the stress in order to help you focus on the mental aspects of the stress. I only have 2 more that I'm going to talk about on this slide. They are doing something fun. I know too many juniors who say things like, I can't do that, I have to study. I can't do that, I have to study. And if you're doing nothing but studying, you're not going to help yourself manage your stress. Take a break, do something fun. Make sure you're finishing your homework at some point, but it is okay to put it away and go get a coffee with a friend and then come back to it. Or put it away and watch one episode of your favorite TV show and then come back to it. Whatever it is, that is something that's fun for you. It breaks up what you're doing. It can help to reduce the stress that you're feeling with it. Allow yourself to take those little breaks. They can be short, but you need to allow yourself to take those breaks. And then the last one is limiting or monitoring your social media. Do you all use a lot of social media? I assume everybody does. Yeah. So I'm not going to sit here on this Zoom call and tell you everybody should delete Instagram because I know that that's not what happens. What I want to really stress is that Instagram is not real life always. Okay. People typically put the things that are the best on Instagram. So they want you to see all these things are so amazing. Nobody puts their bad days on Instagram. So take it for what it is. Try not to compare yourself to others. Be excited when others do fun things, but remember that their life and your life, you don't need to compare. So trying to monitor yourself and make sure that you're not playing that comparison game on Instagram or whatever other things people use now. That's really important. So make sure that you're monitoring that and thinking about that too. Okay, I think I'm almost done. Yep, this is my last slide. And mainly it was because I figured a lot of you were going to be in the college process. My child is in the college process. She's making me very sad because we live in California and she wants to go to school in New York City. So it's very far away from me. And so I'm a little stressed out. She's a little stressed out, but we are working together to help each other. So as you are going through this process, I want to remind you that I actually work at a university. So I know that there's a lot of stuff going on there. Okay. As you're going through, remember your mental health is important in all of this. I know there's a lot of essays to write. There's a lot of, scholarships to apply for. There's a lot of things that you need to think about when you're trying to decide which university you want to go to. But my mantra with my child is you will end up where you're supposed to end up. So whether that is, Pace University in New York City or Roosevelt University in Chicago, wherever it is that you end up, that's where you're supposed to be. Do your best, write your essays, and set your expectations for those college acceptances. Make sure if you are super motivated and you're like, I want to go to this top school, that if it is a school that has a 10% or 20% acceptance rate, that you are aware of that. So you can say, like, they don't take very many people in my program, so I'm going to try. And if I don't get in, that's okay. So set your expectations so that you have some of these really likely schools that you can get into, some of those mid-tier schools that might be a little bit more difficult but are more likely. And then those schools up at the top where you're like, I want to go to Harvard. And it's like, okay, you might not get into Harvard, and that's okay, but you can still try. You just need to set your expectations to know that when you put your name out there, doesn't necessarily mean that you're going to get it. And if you don't get into Harvard, doesn't mean that you're not going to be successful. I actually heard on a podcast the other day that there was, I don't remember which podcast it was because I listen to a lot of them while I walk my dog, but there was a woman who was talking about her college experience, and she went to what she called it a low level university. So like one that most people don't know about, whatever it is. She finished her degree and got her master's at a lower level university, and now she teaches at Harvard. So you don't need to go to a big fancy school to be successful. But doesn't mean that you shouldn't set your sights high. Do your best, try. Somebody has to get in, and it might be you. And that's all I have.
So I'd like to thank everyone for taking their time to explore this topic. I know sometimes it's hard to talk about it depending on what your situation is. And I'd also like to thank Charissa for giving such insightful info today. And if you have, I know that I have many questions, like kind of like talking about like the brain and the mind. And I feel like tonight, like we went over a very prominent topic in today's society where like depression, feeling depressed, being depressed is very common. So I'd just like to say thank you.
I'm so glad you invited me. I am on Instagram, and I know that people tend to like to do the little messages that way as well. My consulting company and my name are on Instagram. So if you would prefer to reach out that way, you also can.